Howdy everybody, welcome to my Poop Tip Tuesday, where every Tuesday I answer your questions that you guys have asked me on my surveys, on DMs, or questions you asked me in my clinic. If you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru and gut microbiome expert. My passion is to give you, yes you, the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button and come see us, your microbiome expert, where we can get you taken care of and get your gut health back on track. So I'm excited about today's video. We have a lot of great questions today. We'll talk about aloe vera juice, what the role is. Can we actually use this to help out when it comes to gut issues? Question number 2, can you heal gastritis naturally, or are there other options to help out with your gastritis? We'll discuss adrenal fatigue. What is it? Is it real? And what can you do to help this out? And we'll do a deep dive on a condition called inflammatory bowel disease. I get this question a lot. What is it? What is going on? We'll go into a deep dive in that. So you guys ready? Let's get started. So hey, Dr. Islam, what are my thoughts on aloe vera to help out with gut issues? All right, it's a great question. I see this all the time. So aloe vera is a natural compound or herb that has been shown, at least in social media studies, to help out when it comes to gut issues, gastritis, reflux, and pain. What is the evidence and what are my thoughts on using this? So here's a couple things I want to recommend. So number 1, I'm always a proponent of doing what you can naturally to help out when it comes to gut issues. And aloe vera can be a natural way to help out when it comes to stomach issues. A lot of us have some burning or sensation of gastritis feeling going on inside your stomach. And aloe vera can be an appropriate use under the medical supervision and under the care of a doctor to use to help out when it comes to gut issues. However, I do have to stress we don't have a lot of evidence that aloe vera can actually help out in terms of research and research-backed information for this. There's been some evidence that taking 1 to 3 ounces of aloe vera juice at dinner time or whenever you eat can help out when it comes to gut issues, help soothe the gut and allow things to be a little bit easier as well. We also have seen evidence that aloe vera can be used as a natural laxative, and we've seen evidence when it comes to constipation. Now these studies are mixed and they're not always conclusive, but it may be an option under the care of a healthcare provider to use aloe vera to help you go and help you poo. Now it's a very small dose, maybe 0.17 grams can be used, and using beyond that, we don't have a lot of good evidence that it can help out. But keep in mind, like everything else in life, there's not a lot of evidence for using these herbal treatments, and sometimes even herbal treatments can have more risks than benefits. Number 2, hey Dr. Islam, I have gastritis. Can I heal this naturally? So let's talk about what exactly is gastritis. Gastritis is inflammation of your stomach. That's what that itis stands for. And there are a number of reasons why people can have gastritis. Sometimes it's an infection called H. pylori that can irritate the stomach and cause gastritis. Sometimes it is medications that we take, like non-steroidal anti-inflammatory drugs, things like Aleve, naproxen, Advil, Motrin. These can irritate the stomach to cause inflammation to occur. Sometimes other substances can make inflammation to occur, like alcohol. Alcohol is a very common reason to have gastritis. Alcohol acts as a toxin to your stomach to cause inflammation to occur. Smoking for sure can cause gastritis. There's nothing good with smoking. It can irritate your stomach, irritate your lungs, and make things worse for you as well. Now, sometimes certain foods can make gastritis symptoms worse. So if you have gastritis, what can you do? Well, first thing I'd recommend is to eliminate the triggering cause. If you take anti-inflammatory medications, stop those. If you drink alcohol, stop that. If you smoke, what the heck are you doing? Stop smoking. If you have an infection called H. pylori, get on treatment for that. Number 2, there are some herbal treatments that can help out with gastritis. One is peppermint. Peppermint tea or other peppermint supplements can actually help out with easing the pain of gastritis and allow things to pass through a little bit easier. Other things that can help out, ginger or chamomile. These are very effective options to help heal up your gastritis naturally as well. And then lastly, but certainly very important, fiber. Fiber supplementation can really help change your gut microbiome and change the makeup of gastritis inside your stomach as well. Other things that can work are licorice like DGL, a medication called Iberogast, mastic gum, aloe vera, zinc, vitamin C, and glutamine. These things can help out with gastritis, help heal it naturally, and calm things down inside your stomach. Question number 3, hey Dr. Islam, I heard about adrenal fatigue. What are your thoughts on this? So let's set the record straight, because apparently adrenal fatigue is a huge social media diagnosis and treatment. But let me tell you what the real research says. You guys ready? Ready? There's no such thing as adrenal fatigue. It is a crock of shit. Now, certainly, there are adrenal issues that can occur, like adrenal insufficiency. This is a real medical diagnosis. But adrenal fatigue, there's nothing like that. That does not make any sense. There's no medical condition like that. You want to know why you're tired or you have adrenal fatigue? It's probably because you're sleeping crappy. You don't sleep well, you don't sleep long, you're watching Netflix at night, you're eating like crap, you have a crappy lifestyle, you're out drinking alcohol out at night. This is why you're tired, because your lifestyle changes, your choices are making you sleepy. It's not because of some made up disease like adrenal fatigue. It's not real. And people who tell you it's real, they are full of it. They're quacks. They don't know what they're talking about. Don't follow them. We eat poorly. We stress over things. We have alcohol. We drink coffee late at night. We don't prioritize sleep. We eat processed foods. These are the reasons why we're sleepy and we're tired. We don't feel good. Don't blame it on this made up diagnosis, adrenal fatigue. Blame it on the things and the choices you are making. So once again, adrenal fatigue is not real, and don't follow anybody who tells you it is, nor buy anything from someone who tells you they can cure your adrenal fatigue. They are full of it. Now, if you have real adrenal issues, see a real medical doctor to get a true diagnosis of what is going on. Next question. Hey, Dr. Islam, do I need to take a liver cleanse? Now, I see this all the time from patients, but also on social media as well. I've seen people giving these ideas that you need to be on a liver cleanse. Well, guess what? If you have a liver and you have a kidney, your body's already cleansing itself. There is no evidence at all that taking a liver cleanse is needed or necessary or even helpful. In fact, it may be harmful for you. Your liver already acts as a natural detoxification unit to get rid of toxins in your body. If you have a liver, it's doing its job. The liver has an amazing ability to not only regenerate yourself, but actually do the job it's supposed to be doing. It takes toxins out of the body and uses the kidney to get rid of that toxins from the body. All you have to do is let the liver do its job. Now, there are ways that you can protect your liver. Have a low-fat diet, exercise, don't gain weight, don't drink alcohol, and eat and drink more antioxidant foods like black coffee. This is going to do a lot better than any liver cleanse is potentially going to do for you. It is critical for us to debunk this idea that you need to do a liver cleanse to get your liver taken care of. It is not necessary. It's a waste of time, a waste of money, and it's not going to give you the benefit that you're looking for. True health, true liver health requires a comprehensive approach. Eating right, living right, sleeping right, and doing right by your liver. These simple things work. They're effective, and they actually will give you long-term benefits. So don't take a liver cleanse, and don't be tricked into doing something you don't need to do. Hey, Dr. Islam, I've heard about this condition called inflammatory bowel disease. What is going on? All right, I like this question because it allows me to really dive into a topic that a lot of people ask about, inflammatory bowel disease. So what this is the group of diseases that include two main conditions, Crohn's disease and ulcerative colitis. They're both under the spectrum of inflammatory bowel disease, or IBD. This is where your body attacks the GI tract for any number of different reasons, whether it's genetics, family history, environment, food, epigenetics. We're not quite sure, but we do see this plays a significant role when it comes to your gut health and your risk factors for developing inflammatory bowel disease. Now, this can present as any number of different symptoms. It could be bloody diarrhea. It could be really watery diarrhea that wakes you up in the middle of the night. It could be abdominal pain, nausea, weight loss, fevers, bleeding. It can really depend on the subtype of inflammatory bowel disease that you have. Now, not everyone who has these symptoms has inflammatory bowel disease. So there are certain tests that we need to do to find out if you have this or not. And sometimes it's a combination of multiple different tests that gives us the picture of what is going on. This can include blood testing or stool testing, see if we can see any inflammatory markers to rule things in and rule things out. It may include imaging like a CAT scan or an MRI to fully look at your GI tract in an objective manner. And certainly, it probably will involve taking a look with a colonoscopy at least to see what's going on. This gives us direct visualization of how your GI tract looks. We can see active inflammation or narrowing or ulceration inside your gut that can give us a higher chance of you having an inflammatory bowel disease. But also allows us to rule out other conditions that can mimic inflammatory bowel disease as well. Now, we do know there are certain risk factors that can predispose you to have this condition. Certainly genetics does play a role. If you have a first-degree relative who does have an inflammatory bowel disease, Crohn's or ulcerative colitis, that can change or alter your risk for developing this condition. Number 2 is smoking. It can be also protective, but also a risk factor for inflammatory bowel disease. We know that food plays a role, and we've seen evidence that food that has a lot of inflammation, processed foods, meats, can increase your risk for developing inflammatory bowel disease. And we know that certain lifestyle choices can also increase your risk for developing inflammatory bowel disease. So if you're wondering if you have this condition or you're worried if you have this, come see someone like me. In fact, come see me, in which we determine exactly what's going on. Do you have this condition? If you do, which one do you have? Ulcerative colitis or Crohn's? And based on what we see and what you have, this can allow us to determine which route of treatment we can go down to get you feeling better and to get your GI tract back on track. All right, guys, I want to thank you for watching. If you haven't already, if you want your question answered on my next Poop Tip Tuesday, here's the thing you need to do. Smash that like button, like, share, and subscribe to my newsletter. So where every couple of weeks I send out a survey on questions that I want people to send me that I can answer in future videos. If you do this, this is the best way to get in contact with us. I want to thank you for watching. Tune in next week. We'll do a deep dive on more videos. Thank you for watching. Don't forget to smash that like button. I look forward to seeing you guys on future videos.